we have everyone in from the waiting room now, and we want to welcome all of you to the conference call tonight. And we're very happy to have our guests with us, Melinda St. and Brittany Shannahan from Public Citizen, and we have Alex Lawson from Social Security Works. Now, we put these two programs together because Medicare, and which Melinda and Brittany are going to talk about, and Social Security are the two programs that are most responsible for lifting seniors out of poverty. Before these two programs, most seniors lived in poverty, or they had to live with their children. And that. So we're going to hear from them about why these two programs are so important, why these two programs should be expanded, and why this is the exact perfect time to expand them, and how we can go about that. I will let you know that you guys are all muted. You cannot unmute yourself. One of us will have to do that. After they have spoken, then we will open things up for questions and answers, and I will give you instructions on how to raise your hand so that you can be recognized. So, Melinda and Brittany, you want to get started for us?
Can everyone hear me okay?
Yes.
Thank you everyone for the opportunity, and thanks to SPAN Ohio for the opportunity to talk with you all. My name is Melinda St. and I am the campaign director for Public Citizen's Medicare for All campaign. Public Citizen is a consumer rights organization, the People's Lobby in Washington, and our mission is to really challenge corporate power in our democracy, and to push for public policy that benefits the people and the environment. And we've been advocating for single-payer healthcare since our founding in the 70s. However, in the past year and a half, we decided to invest more resources in campaigning on Medicare for All to bring our 500,000 members into more of the grassroots campaigning on Medicare for All, as well as to contribute to the really robust coalition effort to win this policy. So I'm excited, and my colleague Brittany Shannahan will also, I will be handing it over to her as well during our brief presentation. So I'm going to share my screen. Assuming everyone can see this. So this is a brief presentation around specifically a campaign that we have been helping to lead with coalition partners around the country to win local city and county council resolutions in support of Medicare for All. Now, I assume that many folks who are part of the SPAN Ohio network are familiar with single-payer healthcare. However, so I won't go into all of the details around why Medicare for All, but I'm happy to answer any questions also in the question and answer session. However, I did want to just begin by laying out what I think probably many folks are already very keenly aware of, which is that the pandemic that we're living through right now has really laid bare many of the failures of our for-profit healthcare system that many of us have been talking about for years. Just some examples of what we've seen in the context of the COVID-19 pandemic is that there are financial barriers to seeking medical care in an absolute crisis situation in the United States. And we've already seen patients early on were receiving surprise bills for testing and treatment of COVID-19. And surprise bills happen because even for people who have insurance, if they go to an out-of-network hospital or they go to an in-network hospital and there is somebody who, a healthcare provider who happens to not be in their network, they could end up getting the tens of thousands of dollars in surprise bills. We're seeing that could potentially worsen as people, if they need to go outside of their preferred provider because hospitals are being overrun, that can mean, again, even more financial barriers to care. Even people with insurance, the co-pays and deductibles that people have to pay, there are over 40 million people who are underinsured in the United States, which means they cannot afford the care, to seek care even with their insurance. And what we're seeing is that after pressure, some of the largest private insurers did agree to waive some of the fees that patients were facing during the pandemic. But because our system is fragmented, this is all voluntary. Many of those promises have premature end dates actually coming up in May 31st. We'll see if some of those end dates get extended by private insurance companies. But what we're seeing is that people still are afraid of the financial barriers to receive care. And obviously during a pandemic, that's not only devastating for the individual, but what that means for our society, as that means that the pandemic there's unnecessary suffering and death due to the pandemic. We're also very concerned about treatments and vaccines. We know that that there's a race to try to come up with a vaccine and good treatments for this pandemic, and yet the way that our system is structured that provides monopoly protection for pharmaceutical companies, it's possible that even all of the public investment that goes into developing these vaccines and treatments could be given to pharmaceutical companies to be able to price gouge and impede access to those treatments. And another real problem that we've seen in the context of the pandemic is that the fragmented nature of our system, all of the hundreds of different insurance companies, and the way that it's impossible to track in a very comprehensive way how the virus is spreading. And we're seeing that in other single payer systems, they've been able to track that much in a much more comprehensive way. And then, of course, finally, as everyone is well aware, tens of millions of people are losing their jobs in the context of this pandemic, and many, many millions of them will lose their insurance when they need it most because of the fact that we tie our health insurance to employment, again, for those of us lucky enough to have health insurance at all. Recent estimates are up to 43 million people may lose their insurance. That will be added on to the nearly 30 million people who are currently uninsured before the pandemic. So this is just a microcosm of all of the problems that we've known for many years with our for-profit system, and that it is more expensive. As you know, we know that we pay double what other wealthy countries pay in health care per person, and yet our health outcomes are far worse than all of our peer countries. And that is because we have a fragmented, very inefficient system that sucks profit out of sickness and instead of treating healthcare as a human right. So Medicare, as Debbie said, Medicare is the program that in the 1960s started to provide universal coverage to everyone over 65 in the United States. It is a very popular program. It is not perfect, and largely because it is not as comprehensive as it needs to be. It doesn't include vision, it doesn't include dental, it doesn't include long-term care, and there's obviously major challenges in terms of the prescription drug benefit as well. So it requires supplemental insurance. It can be complicated for seniors, but it is by far the most efficient way that we provide healthcare in the United States. It has the administrative costs for Medicare are around 2%, whereas private insurance is in the 12 to 15, 16% range. So even though it's providing healthcare to the part of our population that uses the most healthcare, people over 65, it's still much more efficient. And so So Medicare for All, the legislation that many of us have been supporting, is the Medicare for All Act, currently the HR 1384 in the House and S 1129 in the Senate, would guarantee health care for every single American, everyone living here. And so it would improve it by including all of those things that I mentioned: long-term care, prescription drugs, vision, dental, and it would expand that to cover every single person living in the United States for their entire lives. It would provide comprehensive benefits and, importantly, freedom of choice of doctors in hospitals, which we currently do not have. Even those of us who are lucky enough to have insurance know that we have to get our care through narrow networks, and every year they're getting more and more narrow. So this would be every doctor, every hospital in network, and so much more freedom of choice, and eliminating all out-of-pocket costs, premiums, co-pays, and deductibles for every single person. So the way that this is done is through simplifying our Byzantine and profit-hungry system. So it's a single payer. We don't no longer have to have 900 some odd insurers that doctors are having to fight with. Hospitals are having to have these massive billing departments, et cetera. And it takes the profit out of that system, because, as we know, our current system is set up to produce profit as opposed to provide health care for everyone. And it would prevent providers from using these payments for marketing, for profit, as I mentioned, provide global budgets to hospitals, which is critically important, as we're seeing in the context of this pandemic, to be able to put the resources in hospitals for the community that they're serving. And when, as we're seeing, many rural hospitals have been closing their doors over the past years because they haven't been able to, because their population that they serve doesn't have insurance or doesn't have adequate insurance. And so they're providing all of this uncompensated care that's hurting the hospital. So being able to provide the funding that's needed, particularly in the context of a pandemic, and allowing Medicare to negotiate drug prices as they currently are not allowed to, which is insane, and to be able to bring its astronomical costs of prescription drugs down. We save $600 billion a year, the estimates, if by doing that, and that's how we can expand it to everyone. So I'm sure many of you know this much more than I do. So I wanted to focus our energy and our focus on the strategy. And what's been really important in the past couple of years is that as this has become a mainstream issue. It's become a mainstream. It was always good policy, but it was kind of considered a fringe policy position. But we know that it became, right into the center, particularly of the presidential debates. And this year, we also know that the 2018 elections, many candidates who ran on Medicare for All were successful. And in the primaries, we saw that the exit polls in almost every primary, the majority of, and in every single primary that happened, the majority of Democratic voters were supporting Medicare for All, regardless of which candidate they supported. And in the context of the pandemic, we're only seeing those poll numbers increase across the board with independents and even with Republicans. And so what's important is that we want to set the terms of the debate. We want to educate and mobilize the base, which is what has been happening. And I know that's what SPAN Ohio has been doing for many years, but really ramping up and recognizing, that we need to avoid kind of divide and conquer strategies, even within the movement to broaden healthcare. And that's, in terms of looking at some of the policies that are Medicare for some as opposed to Medicare for all, and trying to combat all of the misinformation that's being put out by the industry and the front groups of the industry, and obviously even politicians who have been influenced by that. And so the toolkit, as I know many of you have been engaged in this for a long time, but doing town halls, talking to members of Congress, field hearings, bird dogging, candidates and members, canvassing, using the media. And the thing that we were going to talk about most tonight are local resolutions. And the reason Public Citizen has been focused on this tactic, along with many of our partners, and in addition to the others, is that this is a tactic that is really about building the base from the ground up. And we were a part of a mobilization several years ago with partners with Move to Amend and other money and politics organizations in calling for local resolutions to for an amendment to overturn Citizens United, which was the Supreme Court ruling that that has horrible implications for money and politics in our democracy. And this was, you know, a time when this was considered pretty esoteric. It wasn't something many people knew about. And so, but by doing a local resolutions strategy, city council, town council, little village councils, there are now over 800 local resolutions that called for that constitutional amendment. And that really was what shifted the national conversation and brought it to the fact that then President Obama was supportive, most of members of the Senate, and we're getting to the place where we're getting closer to being able to have that. And HR 1, which was the first bill that the House passed this year, had important elements of the agenda and around money and politics that kind of started from this local resolutions effort. So that's an example of how this has been beneficial in the past. It's an opportunity for local education and earned media to keep the drumbeat going, to bring local government officials into the advocacy with federal and state officials, and it's relevant in districts where a member of Congress is already on board. It's also relevant in a district where a member of Congress is probably always going to be hostile to the policy until they're ousted. And so it's a way to build the base in that during that time. And as we know, for local governments, Medicare for All really would be an enormous benefit. Local governments are closest to the population. They're seeing the well-being or the not well-being of their residents. Where people are getting sicker, we're seeing, in many places, COVID has been rampaging because the population hasn't had insurance, hasn't been able to seek the care that they needed throughout their lives. So they're in a worse situation when COVID hits, or they're unable to seek the care as local communities face bankruptcy or community members. Local governments are the ones who are closest to that. And they also have a huge fiscal burden in terms of providing health insurance. The private health insurance premiums for municipal employees are just going up and up and up, and it's a huge drain on municipal budgets that could be invested in other community services. And obviously, in local communities, for small entrepreneurs and small businesses, trying to provide health insurance can be a huge economic burden, make it very difficult for those businesses to be competitive in attracting talent. And now, if they have to lay off their employees in the context of this pandemic, what happens in terms of their insurance? So that's the reason, those are some of the reasons for this policy, or for this tactic. This is an example. So Medicare for All Resolutions is a coalition effort that SPAN has been a part of. These are some of the national partners that are part of it: National Nurses United, Physicians for National Health Program, and Social Security Works, of course, and then we base organizations like Our Revolution, Indivisible, and immigrant rights organizations like United We Dream, labor groups like the machinists and the electrical workers. So it's a broad coalition of national partners. And we have been working for now more than just about a year in this iteration of pushing for local resolutions, and there are more than 300 efforts underway with more resolutions being passed every day. I want to turn it over to Brittany, who is our lead organizer for the resolutions campaign, who's talking to people all over the country about this, to say a little bit more about how the strategy's been working.
Great. Hi, everyone. So I did unmute myself. So Melinda's keeping her presentation up, and I will take on from here. What you see in front of you is, it's actually, it's not the most up-to-date map. It's a lot greener and a lot bluer. We've passed a bunch of resolutions since this happened. And so if you go to our website, which is Medicare for All Resolutions.org, you can see a list of the resolutions that have passed, and you can see the up-to-date map. So I put the website in your chat. If you just go to MedicareForAllResolutions.org and you click find a resolution in my town. So Melinda, if you want to go to the next slide. There it is. Okay, great. So this is a list of some of the resolutions that were recently passed, including some resolutions in Ohio, thanks to the hard work of folks in this group. There was a resolution for Lucas County in June last year. One just got passed in Newburgh Heights, and there's other resolution efforts all over Ohio and have been basically since the day I started working on this. So, but on our website, on the page where we have the list of all the past resolutions, you can read those resolutions that were passed and you can use it as a template. One thing that people have found to be really useful recently is to, when they contact their council member, to attach a copy of a past resolution. So you can say, oh, well, this is the one that Lucas County passed. And then they'll be like, oh, well, maybe we should do it. So if you want to go to the next one. Great. So steps for passing a local resolution. As Melinda mentioned, we have a very detailed toolkit that is on our website. There's a little image of, there's a little screen grab of what it looks like, our Tools for Activists page. It has a pretty comprehensive overview of all the things that you might need to get your resolution passed. We've also updated the website with COVID-19 specific tips, which I'll go to in a second. And so some of the steps that are put forward there are to look at this sample resolution. This is, we have the, oh, sorry. So if you, there's the resolution. Sorry, I'm a little bit behind here. We have the sample resolution language that you can click out, you can check out and put forward to your local council member. You can come up with your own, or like I said, you can read the others on the website. In many cases, if there is a state single payer initiative or a bill that the people organizing the resolution want to also support in addition to the federal bills, they'll go ahead and include that. And so what the resolution does is it says that the town supports this legislation, and it sends a recommendation from the town's government to the federal representatives and to state legislators, if applicable, that they need to take action and take responsibility. There was a question about, is the resolution a law or stating a desire that the city wants a law to be passed in the future? I'm not entirely sure about how you get in legalese for law. It's basically like if you think of signing a petition, this is basically the whole city signing a petition. And especially when you're looking at, one of the big hurdles has been to get members of Congress and senators to sign on, then you can use your resolution to say, well, actually, people in your district do want Medicare for all. It's a lot harder for them to resist. So here's some ideas for organizing in the time of COVID-19. One group in New Orleans, they incorporated the Healthcare Emergency Guarantee Act into their resolution, which was a resolution in support of both the federal bills as well as the Healthcare Emergency Guarantee Act, which is the emergency legislation put forward by Sanders and Jayapal's offices that would immediately expand Medicare to people who need it in this crisis. Another idea is to reach out again, like in many cases, people in the two resolutions that were passed recently in the last few weeks even were New Orleans and Ann Arbor, Michigan. In both cases, it was it was not the first time that the contact had been made with the council members, but council members were much more receptive to hearing about these resolutions at a time when their constituents have been calling them and telling them that they could not get the health care they need. They couldn't get the insulin they needed because they lost their job and lost their insurance through that. So, we thought that maybe council members might not be as receptive with everything going on, but it's turned out to be the opposite. This is an opportunity for the council to take a stand and say, look, we have limitations in what we can do. We need the federal government to step up. Another thing that you can do is really to use storytelling to connect the COVID-19 crisis to our ongoing healthcare crisis. As we all know, this country, this is not a new crisis. This is just the same crisis that's been updated. And so bringing this together and using the COVID-19 makes a lot of cases, especially when it comes to the removal of the urgency of removing insurance from employment. COVID-19, what has happened in the last few months, makes a very compelling case for why we need a single-payer federally managed system. Some other ideas for organizing in these times, we found that groups that have been really successful in their efforts have been holding regular weekly or twice every 2 weeks organizing calls or Zoom calls so that they can divide and follow up on tasks. Some council members who are expected to introduce a resolution have been attending these organizing calls and have sort of been there and have been actually a much bigger part than they have in the past. Another idea is to join forces with other regional and national organizing groups like us to form a regional or statewide webinar like this, which SPAN has done, that can be used to recruit new people into resolutions efforts and to build stronger relationships with other organizations. Like one of the reasons why this webinar is working out so well with SPAN is because bringing in other national groups with local supporters like us who can then reach out and try and bring new people in helps strengthen this movement and makes for a much more cohesive activist community. Another idea is to invite a local congressperson who has signed on to the Medicare for All bill to join one of your resolutions organizing meetings and to report back on what they're doing to support the movement. I think that has been like really, it's also helpful for us if they signed on for them to see that we are still organizing and that we are holding them accountable, and we expect them to see the movement and the momentum that we have. Finally, we've had some activist groups we work with that have organized these caravans and other socially distanced rallies. In the case of just wanting to do something that isn't meeting by Zoom, that seems to have worked out quite well. Yeah, so Melinda, if you could go to the next slide. So sorry, is this you?
No, go ahead. Yeah, I think so. Unless
okay,
was there anything?
No.
Yeah. I think we have a little bit of a delay. Sorry, folks. Well, thanks, Brittany. So that's all of the ideas that she put forward. We'd love to talk with any of you about how we can support the work that you're doing. In addition to the resolutions, we wanted to just also point out that on our toolkit. And on the website, we have COVID-19 specific resources and talking points that can be used outside of the resolutions work, such as writing letters to the editor or op-eds. This is a very important time while we're all at home to be putting out these messages to our local papers, and we can certainly help you. Our comms team can help edit, can help pitch if that's helpful to you. We also have COVID-19 Medicare for All related posts and tweets and there's a toolkit there as well. Social media posts, if you can amplify those, or ideas for how to use social media to amplify this message when people are really thinking about how broken our healthcare system is. And we can also provide support for virtual meetings. Obviously, SPAN is already on target in doing that. But if there are town meetings or regional meetings that you'd like help with the technology or with recruiting people, as Brittany mentioned, we have all of the national organizations that are part of this. We can reach out to their membership as well. So basically we want to kind of leave it there. Please look at the toolkit if you haven't already. And I wanted to just also mention that we have been having national webinars monthly, and our next one is this coming Thursday, May 28th at 8 p.m. Eastern. We will have Representative Judy Chu, who is the chair of the Asian Pacific American Caucus in the House, as well as Dr. Abdul El Sayed, who is a longtime champion for Medicare for All and former gubernatorial candidate in Michigan, and one of the New Orleans City Council members who passed this resolution just a couple of weeks ago to talk about their perspective as well. So encourage folks, we can put into the chat the RSVP link for that as well. And we certainly look forward to answering any questions that you have.
Well, thank you very much. And we'll look forward to asking you some questions in a little bit. Right now, what we're going to do, I'm going to bring up Alex Lawson to talk. But before I do that, I want to share one of the things that that we did and what we've been doing. And I have to find it first. Okay. Okay. Something other than a Zoom meeting is we have joined with Our Revolution and a number of other organizations, and every Sunday between now and July 5th, we will be working on the Road to Justice and Freedom, Healthcare Across Ohio. And we're trying to get as close as we can to Route 42, which runs from Cleveland down to Cincinnati, and line that route in support of our local bill, our statewide bill, House Bill 292. And so you can join us if this is the website, Our Revolution website. You can find the places where the rallies will take place. We are socially distanced. We are wearing masks. And this afternoon in Ruby Red, Medina, we had a pretty noisy afternoon as cars honked in support of Medicare for All. So don't be afraid to go outside of the choir room and talk and target people that are not singing in our choir, because they may want to be in that. So you can see, you can click on one of the locations here, or you can check out on the map, and I understand that there will be more locations next Sunday. And so we'll look forward to having you join us there then. Okay, Alex Lawson is the Executive Director of Social Security Works. We've seen lots of talk about we need to cut Social Security. That's always the first thing that we come to, in any time of crisis, is we need to cut Social Security. And I believe that Donald Trump even talked about the next round of stimulus payments or stimulus measures would be taken out of future Social Security payments. Now, Social Security is incredibly important, not just for us old folks, but for disabled people as well, and in that, as it provides some basic income to keep people in a home and taken care of. When we're talking about health care, medical care is one aspect of it, but we also have to consider the social determinants of health, and income is one of those. Those in poverty tend to have poorer health. They tend to die sooner of diseases that can be treated if they're treated early enough. But because of poverty and its restrictions, they often are not. So, Alex, I'm going to turn it over to you.
Wonderful. Thank you so much, Debbie. Unfortunately, I don't have a PowerPoint, so it's just going to be me and my face on your Zoom pontificating some, and I'll try to vacillate between my rage and outrage, and then the hope and knowledge that we will win by standing together. So something that Debbie just led with, that I usually don't lead with it because, well, I don't know why, but Social Security does lift more Americans out of poverty than any other program that exists. It lifts right around 22 million people out of poverty. And that includes 1 million children, because Social Security is actually a lifelong system. It's a wage insurance system. And it protects against the loss of wages due to retirement, if you face a life-changing illness or injury and become disabled and can no longer work, say like the coronavirus, then Social Security is there for you. If the breadwinner of a family is tragically dies, and then Social Security provides for the lost wages to the minor children in that family, say again, like something from the coronavirus, we're seeing that Social Security stepping up for say some of the tens of thousands in New York who were cut down and had minor children. I'll put the rage in the middle of the presentation because that's when we're going to get to long-term care and nursing homes. But right now, we'll stay at that Social Security is this amazing program. And the reason I don't start with poverty is because in Washington, D.C., usually when they talk about poverty, the next thing they talk about is eliminating the program that deals with the poverty, because Washington, D.C. is a very messed up place with wrong priorities. But what Social Security does is it actually prevents people from falling into poverty in the first place. It's a poverty prevention program. And I want to read, I know this is the most boring, but I happen to love this FDR quote so much. I put a link to the Ohio State report that has all the data on Social Security and Ohio, including district by district, how much benefits go in, how many people receive them. Very useful for field organizing. But here's what FDR said on August 14th, 1935 in the bill signing. I think most people on this call at least know this one. We can never ensure 100% of the population against 100% of the hazards and vicissitudes of life. But we have tried to frame a law which will give some measure of protection to the average citizen and to his family against the loss of a job and against poverty-ridden old age. This poverty-ridden old age, sorry, that was supposed to be a hyphenated word. This law, too, represents a cornerstone. That's why I read this quote. A cornerstone in a structure which is being built but is by no means complete. And now I'm going to be even worse, and I'm going to read a second quote by Frances Perkins. Frances Perkins is actually the brains behind the New Deal, the first woman who was the cabinet secretary, ran the Department of Labor. She is an amazing figure. I oftentimes judge my actions by how I think Frances Perkins would be judging me for them. I try to make it so that the things I do would make her proud of our work. She said, "We cannot be satisfied merely with makeshift arrangements which will tide us over the present emergencies. We must devise plans that will not merely alleviate the ills of today, but will prevent, as far as it is humanly possible to do so, their recurrence in the future. So why did I read those two? Because what I want to talk about is how everything that Melinda and Brittany were talking about with Medicare for All, that is the original vision of Social Security. There was a national health plan in the original Social Security Act that was stripped out due to right-wing opposition at the time. There can be no security without health. You can't have security, economic or otherwise. If you get sick, you go bankrupt. If you get injured, you go bankrupt. Your children can't be taken care of because you got sick. Well, guess what? Over the course of our lives, all of us get sick. And the only way that we can protect against those vicissitudes of life, not saying that we can make it so that we all don't get sick, we do. But what we can do is working together, build a system so that nobody goes bankrupt because they get sick. So that nobody dies because they're rationing their insulin, which is over 100 years old and was produced with our taxpayer dollars. This is the system that we need to build. So I'm not going to talk about Social Security as a static program that provides checks to people today and tomorrow. I will give you all the facts and figures so that you know that, man, does it work, man, is it strong. There's no need to worry. It literally can't go bankrupt. But what I want to do is talk about the fact that this is an ever-expanding system of economic security. And if we don't create a response to this current pandemic that makes Frances Perkins proud, we will find ourselves right back here again in a decade or in 20 years or at some point in the future in the same exact place, because we'll have dealt with the problem today, but not built a structure like Social Security that actually it prevents problems in the future. So let's do a little bit of Social Security today, and then we'll get to the where we need to go. So Social Security today is incredibly healthy. I dropped a bunch of links in the chat. One of them is Nancy Altman's Forbes article on the trustees report from this year, which shows yet again that Social Security is the most small c conservatively managed program in the US government. Its finances are amazingly secure. That's my 4-year-old son knocking at the door. I don't know if you can hear that, but he will continue knocking. I might have to bring him in to say hello. Is that okay with you all? Is that a thumbs up? If I give okay, hold on.
Like kids.
Just quickly, you get to say hi. Say hi.
Hi.
Okay, Xander, now I have to go back to work. I know. Hey, Neil, please. Thank you, Xander.
Okay,
Thank you. Now he's yelling, knock it off at me, telling me not to work. So Nancy's Forbes article is on the state of, that's Xander is his name, and he is adorable. And this pandemic is hard on little children. He's 4. My daughter's 2. I don't think any of it's really processing, but for Xander, this is very hard as well. So it was fun for him to say hi to you. He really gets a lot of joy out of that. So thank you. The Forbes article that I posted is Nancy Altman's analysis of the trustees report, which shows, again, Social Security's got $2.9 trillion in trust. Social Security pays out 100% of benefits till 2035. 100% of benefits. After that, it pays out 85% of benefits for the next 50 years. After that, it pays out 82% of benefits for the next 75 years. You tell me anything like that in the U.S. government. How much reserve money does the Defense Department have? I'll tell you, the answer is none. Social Security is the only system that looks out 75 years, sees everything is looking great, and still the news media are like, oh my God, it's going bankrupt. Has everyone noticed that? Does everyone always see those headlines and wonder, how come I'm always told that this system is going bankrupt? The reason is because these greedy liars on Wall Street have always been after our money. Since the inception of Social Security, they just can't stand that they can't get their greedy little hands into our pocket to steal our money. So they came up with a plan. First, they came right at Social Security. They used to run against Social Security. The first presidential candidate to do that was Alf Landon. He ran against FDR, ran against Social Security. And he lost every single state except for 2 because everybody loves Social Security. Something else that was mentioned way in the beginning by Debbie, before Social Security, 1 in 2 seniors, over 50%, it was 52% of seniors lived in poverty before Social Security. Before Medicare, so Social Security is enacted, it brings it down to about 1/3. But see, that's the thing. If you don't have health care, where's your security? Now you get Medicare in and we bring down senior poverty to right around where it is average population, which is obviously far too high in a country as rich as ours. $19 trillion GDP. Germany has a $4 trillion GDP. Our unemployment rate is around 25% right now. Germany's never got higher than 6% and is currently at 4% right now, facing the exact same pandemic. So that's a little sidebar here. What these billionaires try to do is decrease confidence in the program. They try to convince people they're going to get nothing so that they will accept less than they're owed. One of Pete Peterson, this billionaire, he's a late billionaire, but his money lives on in perpetuity, always trying to destroy Social Security with the Pete Peterson Foundation and the Committee for a Responsible Federal Budget, their front group. The head of that actually accidentally said that. She said the goal is to convince people they're going to get nothing so that they will accept less than they're owed. Because if you believe you're going to get 0 and I offer you 70 cents on the dollar, that sounds pretty good. But in fact, what you just did is gave away 30 cents of every one of your dollars that you're owed. And that's the thing about Social Security. It's our money. We all know that here. We pay into it. Our whole working lives, we pay into it so that it's there for us when we need it. So the good news is Social Security, eminently affordable. Social Security works exactly as it's supposed to. For 85 years, through war and peace, through boom time and bust, through health and pandemics, Social Security has never missed a single payment. Now you're talking about people look at their 401ks and they drop into 201ks and then back up to 401ks and then down to 201ks because Wall Street is not actually a way that we can plan a secure retirement. Social Security is the rock that we can count on. We saw that in 2008 and we're living through it right now. So Social Security is doing great. It works exactly as it's supposed to. It does all of that. Inflation protected annuity, right? The retirement benefit. $1 million in long-term disability insurance. $1 million that every working person has, right? That's me. I'm covered by that right now. $1 million in life insurance covers me for Xander if I lose my life in any way, if the coronavirus or anything happens. I carry all of that life insurance and long-term disability insurance right now because I pay into the system. That's what the guarantee of Social Security is. We have to expand it. So now we'll go into the part of what's missing and what has COVID laid so bare. Why have 27,000 seniors died of COVID-19. 27,000 seniors have died. Nursing homes across this country have become death traps. And it doesn't matter that residents are receiving their Social Security benefits, either retirement or disability, when they're dying and no one is lifting a finger to do anything about it in these nursing homes. Why is that happening? Because we don't have a long-term care program in this country, because we have allowed private equity barons, Wall Street, to buy up all of the nursing homes. They extract the value, primarily the real estate, fire the workers, replace high-skilled workers, RNs, with lower wage workers who then have to work at multiple nursing homes to make ends meet because they're being paid poverty wages. And what does that do during the pandemic? Makes nursing home death trap. What kind of security can you have if the end of your life is a crapshoot and the dice are loaded by these private equity barons and they're extracting wealth from us by denying us our health care now? That's what Melinda and Brittany were saying. They're extracting wealth from us by denying us the prescription drugs that we need. And just to add insult to injury, we pay to develop those drugs. It's our taxpayer money that develops those drugs. Our money develops those drugs. And even when you're on Medicare, you get Medicare Part D, but guess what? Pharma reached their greedy little hands into the process and made it so that Medicare couldn't negotiate. Like Melinda said, the most corrupt thing that I've ever seen in this town, in Washington, D.C., which many corrupt things do happen there. But this one really took the cake. The guy who made it so that it wouldn't, Medicare would not be able to negotiate the day after it became law. Do you want to know what he did? He became the head of pharma, a pharmaceutical lobby, for $1 million a year. So even Medicare has these problems that leave us insecure. You can't have security even if you have Medicare, even if you have the supplemental coverage, which we shouldn't need. Why do we exclude vision, hearing, dental from Social Security? And obviously, if you don't have long-term care, you have no security. If the price of your prescription drugs can go up so high that you can't afford it, even if you are supposedly, covered with Medicare, you don't have any security. So it's a big lead in. I actually don't know how long I talk, but usually I talk for too long. So I'll start wrapping it up now because I usually have like 2 wrap-ups before I actually stop talking. The first thing is, there is a bill. It's a fantastic bill. We've been helping to push it for a long time. It's Social Security 2100 Act. John Lawson is the author of it. This man lives and breathes this bill. It is a really tremendous work that he's doing, and we're proud to work with him on it. It has 208 original co-sponsors on it. And anyone who works in DC can tell you that is an astronomical number. It can almost pass right now with original co-sponsors. But the problem is that it's not going to pass. It's not going to pass because leadership doesn't want it to pass and is still standing in the way of it, even though 208 original co-sponsors are on it. And then I love this bill. I've spent years pushing for this, and all 4 members of the Ohio caucus are on the bill. But I want to be honest about this bill. It definitely fixes a lot of stuff on the edges of Social Security. It increases benefits by about 2%. And it, yes, whoever Bob is pointing out, Billy Towson is the dude whose name none of us should have to remember. Just the corrupt. We should just call him that corrupt guy who made Medicare not negotiate. But Billy Towson. Social Security 2100 Act increases benefits by 2%, which is great. I want that 2% because it also has solvency extended into the next century. It also changes the way that the COLAs are calculated, the cost of living adjustments, so that they increase a little bit more. And that's all very good. He's got a version of it that he's fighting to get into the COVID response. Obviously, it didn't get into HEROES. It's not going to get in. I'll keep fighting with John Lawson, because man, does he never give up. But it's clear that it won't get in. In the Senate side, Elizabeth Warren is fighting to expand Social Security benefits by $200 during the crisis. But I actually, it's not going to get in either. We will fight for it. We will fight, tooth and nail for this one. But the Republicans will not give on expanding Social Security. Does anyone, these are all rhetorical because I'm just talking to myself here, but does anyone know why they're so terrified of Democrats expanding Social Security right now? The reason is that their plan to just let seniors die, to murder them through inaction in nursing homes, is very unpopular with seniors and many other people as well. And so you've seen Donald Trump's approval ratings among seniors fallen by somewhere between 10 and 20 points in battleground states. That is an astronomical number in politics. And so the Democrats are trying to put forward bills. Yeah, actually, the nursing home part is in HEROES. Jan Schakowsky put it in HEROES, and we have Bob Casey in the Senate and Sherrod Brown in the Senate, who are going to try their hardest to get it all the way to the finish line. And we might be able to. Why am I laying it out that way? Because look at where we are today. 1/4 of Americans, somewhere around there, are unemployed right now. 1/4. That it took in months. It took years to get there in the Great Depression. 100,000 Americans are dead from COVID-19. Under 300 in South Korea, just as a side note, because this is an absolutely beatable bug, but we choose not to do it here. Incompetence and corruption. 100,000 American dead. That is in velocity faster than the 1918 pandemic influenza. We're in the middle of the Great Again Depression, which is what I call Donald Trump's depression, and the 2020 1918 Great Pandemic at the same time. So I want those 2%. I'm going to fight for them. But we need to fight for way more to make Frances Perkins proud now. We need to fight for all of the things that Melinda was talking about and more. We need to, the response has to fit the magnitude of the crisis. We need to be talking about increasing benefits 50% or doubling Social Security benefits. We need to be talking about lowering the retirement age from 65 to 55. These are the solutions that match the magnitude of the pandemic. At the same time, we institute Medicare for all, including long-term care. And how are we going to pay for it? Melinda went through a few of those ways, but the reality is it pays for itself. It pays for itself. The only thing we can't afford in the society that I'm talking about that takes care of its people, today and tomorrow, the only thing we can't afford are billionaires. And the only thing that we have to lose is Jeff Bezos becoming a trillionaire. And I am willing to let that happen. No billionaires, no trillionaires, but we all get health care. We all get a retirement. We all build a system that protects us against some of the vicissitudes of life. So I'm going to end with that. And I will say, keep your eye out, because we will have a lot of stuff coming down the pike that are the bigger ideas. We'll keep fighting for the steps along the way, but we have to have a response that matches the magnitude of the crisis that we're in right now. Thanks so much.
Oh, wow. Thank you, Alex. That was absolutely tremendous. And I knew when I heard you back in October in Portland, I knew you would do a fantastic job for us. We're going to go to questions and answers at this time. John Ross and Matt Nordsey Jones are going to be monitoring the hands that are raised, and they will unmute you in the order that you raised your hand to ask your question. Bill Davis will be monitoring the chat, and we will go from through Matt, John, Bill, like that. Okay, so we'll start with MJ.
All right, the first question we have looks to be from Pia. Pia, let me go ahead and unmute you. All right, go ahead, Pia.
I just had a question. There are so many different groups that are organizing and having different meetings and different things. Is there some way that there could be some kind of a page between all these different groups and list all the different activities or webs or webinars or Zoom programs that we might want to sit on? Because it sometimes it gets kind of confusing. The different websites and the different Facebook pages and different things. I don't know if that's just too overwhelming or unrealistic, but I just thought I'd throw it out there.
Thank you, Pia. We'll take a look at that and see if there's something that we can do to keep you.
I wanted to I could just say, this is Melinda, that Brittany had the great idea. We actually have an intern starting soon, and that was one of the things we were thinking about doing with that person, is actually try to pull together that kind of calendar. So hopefully we'll have something like that relatively soon.
Thank you. Why don't we go to Mike Carano, and then we'll go to the chat. Yeah, go ahead, Mike.
Yeah, that's the question. I just was wondering, I know that there's been talk about ending the cap on Social Security, which was, I don't know what it's at, 120,000 now or something for those making over. What would that actually, if that were done, have they ever done anything statistically to show what it would do to even better ensure the solvency of the program?
The Social Security cap is at $137,500 right now. For the vast majority of Americans, we pay in on all of our income all year long. But for those making over $137,500, they stop paying in on the next dollar. So you can also think of it as Jeff Bezos stops paying in at like the first minute of January 1st every single year, and then he doesn't pay in for the rest of the year. Millionaires stop paying in right around Valentine's Day. People who make $1 million a year, just to give you an idea. So what we should do is we just get rid of the cap completely. And not only do we get rid of the cap completely, we cover all income. So both earned income and also investment income, because that Jeff Bezos guys, he pays the lawyers who figure out how to sneak his income around way better than he does his workers. So we need to grab all of that capital gains and we need to bring it into the system. And then we flatten it so that they're not getting huge, multi-million-dollar Social Security checks. And then what that does is it allows us Social Security solvency, for forever. And it's extremely solvent as it is. But it fixes that the 0.86% of GDP. And then we can expand benefits. And Bernie Sanders has included that mechanism in his bill. Now, what I say is for the bolder ideas, increasing benefits by 50%, lowering the retirement age to 55, these are very common sense ideas coming out of this pandemic. We're going to need to do more than that. We're going to need to actually have millionaires and billionaires. Right now, we need to have millionaires and billionaires pay the same rate on all of their income, just like the rest of us. But we also are going to need to tax them more, a wealth tax, or a Wall Street transaction tax. There's a lot of ways of doing it and then dedicate it to Social Security. So we absolutely have to scrap the cap on all income, and then we should do more so that we can be bolder as the times demand.
Okay. Bill Davis, do we have a question in the chat?
There's one question. Mary Huck said, so in effect, is the death of so many Social Security recipients enriching the Social Security coffers. All the seniors, I guess she's referring to, that are dying of COVID-19.
No. So the just the magnitude of the program is so large, it's hard to sort of envision. But the short answer is no. But then I'll give you another little thing so you can have it. And I actually put into the chat a COVID Q&A on Social Security. I can put it in again, but there's one of the links from Social Security Works is a Q&A on how coronavirus affects Social Security, and I'll drop it in again. But even at, just to grab the magnitude, even at a rate of 25% unemployment, so right now, because there's also this meme out there going around the news where coronavirus is going to make Social Security go bankrupt. So you asked, is it filling the coffers? No, it doesn't have that. The deaths do not have a measurable effect. They're real lives lost. It's not about money. I'm not saying you say it is, but just pointing out that the 100,000, even if 27,000 deaths is not going to affect Social Security, 25% unemployment for a full year brings the trust fund exhaustion date in by 6 months. So one whole year of a quarter of this country being out of work, the effect is to bring it in 6 months. So the system is incredibly sound and well managed. So none of these, nothing that coronavirus is doing is affecting the Social Security system. What it's showing us is the failings of all these other systems and why we need to build more on the foundation of Social Security to deal with the failings of, say, the for-profit healthcare system.
Hey,
Okay, that's I think the only questions that I've seen in the chat have been addressed.
well, there is another question in the chat from Patrick Henry. It's a question for Brittany. When presenting to county or city council, there are obvious advantages for Medicare for All. What are the typical objections?
Yeah, hi.
Hi.
So it's kind of a trick question because the typical objections are about the same as you'll find anywhere else. And the city councils are kind of funny. If someone is a Democrat and they're on a city council, they may not want to introduce a resolution, and they may try to convince other council members otherwise if they're like really against it. But if someone has objections to Medicare for All, that just, you can find someone to introduce it for you, and that person who had slight reservations and questions will then vote yes for it. So in terms of in our toolkit, we do have a list of very compelling reasons for city government. Melinda can put the link in again for why the person should support Medicare for All. The reasons to convince someone are about the same. But the lucky thing is that it's not like you have to convince one person. So sometimes you can convince someone to come to your side, but really what you're trying to do in your first outreach is to just get a meeting with them. It's very rare that you're going to be in that position where someone is going to give you a meeting and say no. It does happen, but that doesn't normally come up. So short answer, it's pretty much the same. People raise questions about how we're going to pay for it. They may say that the city doesn't pass resolutions, even though 2 days before they passed a resolution, in honor of the local ice cream shop that's been open 100 years. So they may give diplomatic no's, but some of those people can come around in time as well.
I would also just say that the argument that sometimes you hear is just that this isn't a local issue, that this is something that's national, and then that's part of why we have the talking points about how absolutely this is a local issue because it's affecting this community so extremely, and then also, of course, how much it is costing the city, and actually how much savings there could be under a Medicare for All system.
Right. It's definitely a local issue in a pandemic. So when somebody says that, if somebody says that, wow.
Great, thank you. NJ, do we have anyone else from the with hands up?
Yes, next up is Bob Crazen. Bob, let me go ahead and unmute you. All right, Bob, go ahead.
Hi. This is almost more of a comment. I want to thank Melinda and Brittany for their help trying to help me get a resolution through Columbus City Council and the Franklin County Commissioners. We've been unsuccessful so far, and I think their point is you can never tell when the climate is going to change, and you may have an opportunity that you didn't see before. I noticed that Ann Arbor, Michigan passed the resolution, and everybody in Ohio ought to perk up with that and realize that Ann Arbor is the location of Michigan football. And Ohio State is Columbus, Ohio, and we don't take that lightly when Michigan does something that beats us. So I think that presents another opportunity for us to go back to the Columbus City Council and get them on board with this, in addition to all the information about the COVID crisis that's driving us all over the wall. Thank you.
I really hope you get it because of football. That would be fantastic.
There is one more question in the chat.
Okay.
Mont Given asks, what about the bigger picture? Is there any hope of getting this passed while we have a Republican president and Republicans control the Senate? I thought Alex addressed that.
Well, this is Melinda. I mean, I would say we don't expect Medicare for All to pass with with the Republican-controlled Senate and the current president. And so the work is really building the base, making the case, working at all levels, working around money in politics, working to change the political dynamic. And we know that actually even with a Democratic president and Democratic Senate, our work we still have to do very strong base building work because pharma and the insurance companies, they don't just contribute to Republicans. They know that the writing is on the wall, and that we're not going to continue to allow them, as Alex was saying, to basically steal our money. And so they're going to do everything they can through attack ads, through campaign contributions, and through both parties. And so this is not a Pollyanna-ish thing. We know this is very, very difficult to make happen in the political situation that we have, but we have no choice but to build that power. And and COVID, I think, as Alex was saying, everything has changed now. We need to act like everything has changed, and that we won't accept tweaking around the edges. It's just not going to work. And so that's part of why we want to build it up community by community and holding all of our elected officials accountable, Republican and Democrat. And if they're not going to work with us, work to get them out. That's what I would say.
Okay, thank you. John, do we have any, you want to take care of, introduce people from the raised hands list?
I think we lost him. I can go ahead. So next up on that list, I think we have Kimball Strickland, and you are unmuted. Go ahead, Kimball.
Yeah, I think all of us that are in support of single payer or universal coverage, we've been collaborating and coalescing, so it'd be naive of us to think that those that are going to oppose it aren't doing the same. and maybe this, Alex, you might be able to address this as Washington issue. What might we anticipate as their primary attack points against these initiatives? And what are going to be the primary messages that they'll use to scare people, or we've heard about, well, this is the first step towards quote socialized medicine, et cetera, this stuff. But I'm sure they're going to be a lot more organized when the stuff really comes out. What would you anticipate as being like the top 3 points they're going to try to, market?
This is where I have an almost unfailing crystal ball. Because I can't tell you what's going to happen in the election, but I can tell you what the response will be based on what happens. So if Donald Trump wins, they're just going to keep on coming to try to steal everything that's not bolted down, and they brought bolt cutters with them as well. If the Democrats win the Senate and the White House, so then there's this trifecta, and there's a possibility of something happening. And we are coming out of this pandemic, and over 100,000 people, it could be 250,000 by then. But right then, at that exact moment that the Democrats take power, the deficit will take on such an enormous magnitude that every single news piece that you see from MSNBC, CNN, Fox News, it'll run just all day. Washington Post, New York Times, LA Times, doesn't matter. They are all going to be saying, oh, the deficit, the deficit, the deficit. You're going to have all these incredibly rich people who are going to be saying, no, it's not about my money and the fact that you want to raise taxes on me. I promise. I'm trying to help you. It's the bond vigilantes. They're right around the corner. Hyperinflation. Haven't you read about Weimar Germany? All of it is bullshit. It's the exact same thing they do every time. And the problem is that Democrats either fall for it or are complicit in it. And that's why this organizing is so important. Before FDR came Hoover, right? That's important to remember, that before FDR came Hoover, before the response came the crisis. But it's also super important to remember the history that FDR, when he famously said, make me do it. But that was totally true. That was a great line of his because he was a great politician. But that guy was not, he rose to the moment because around the country, there was a pressure to do way more than the New Deal. So Social Security was a compromise position compared to a grassroots organizing thing that happened then that is still mind-bogglingly beautiful. You should all read about it, called the Townsend Plans, organized before social media, before easy communication, community by community by community, for a hugely robust old age pension program. And that grassroots heat is what forced FDR to actually act. And Francis Perkins, Arthur Altmeyer, and the other architects of the New Deal showed him the way. And Eleanor Roosevelt had the good sense to nudge him right over. So the attacks they're going to bring are going to be deficit. How are you going to pay for it? Deficit. We're going bankrupt, all of that. The response is what Melinda and Brittany are doing and what we all need to be doing, which is building a grassroots narrative that shouts that down starting now, and never, ever let the age of austerity happen again. Because remember, this is exactly what happened in 2010 when Barack Obama was put into a place where he put a commission in place. Oh, here's Xander. He's coming in to join. He also believes that we should never have the age of austerity again. We should never have austerity again. See? So that's what they will. That's what they'll do.
I would also just say their arguments are tired, and they're just basically lies. I mean, that's the thing. They'll say that you can't afford it, when of course what we can't afford is the current status quo. They'll say that it's going to make, with Medicare for all, they'll say it's they're going to take away your choice of your insurance company, which of course is just totally bogus. None of us choose our insurance companies. It's our employer who does if we're lucky enough to have insurance. And we don't care about our insurance companies anyway. We really only care about our doctors and hospitals, which we'd have way more choice with Medicare for all. And they'll talk about hospitals closing, and because they won't be able to afford Medicare reimbursement rates, which is actually the opposite, because it's rural hospitals are closing now because they can't afford the current system. So, again, those are some of the arguments that we'll continue to hear. And I mean, but the point is really a good one. We actually at Public Citizen did looked at the lobbying dollars that were, or the lobbyists that were lobbying against Medicare for All. And as it became more and more of a mainstream issue, just even between 2018 and 2019, the number of lobbyists increased ninefold in the first quarter of both of those years, because these companies were seeing the writing on the wall and actually are taking the policy seriously. It was also that the most political ads throughout the summer in Iowa before the Iowa caucus were against Medicare for All. So this was, again, this concerted effort to spread lies about the policy.
So I know we have more questions, but just because Melinda led that off so well, the most money that was spent in all of the early states was against Medicare for All, and yet Medicare for All actually outpolled every politician in every single early state, even against the onslaught of money, because this is an idea whose time has completely come, and that was before the pandemic.
Okay, NJ, do we have other people with their hands up?
Yes, it looks like we have one more with their hands up. Actually, it's Pia. Pia Canistros, go ahead again.
Just a comment. I think it's very interesting with the pandemic and what's going on, because a lot of healthcare workers across the country are shouting now. They are fed up and tired of the way healthcare has been taken away from healthcare professionals, and all the people at the top who are getting paid the big bucks, who are redundant and are not making good choices, are running the show. I said, if this happens again, you might see a change. And I actually wrote to our Republican, the House of Representatives and the Senate about this in Ohio, that be forewarned. People are not going to tolerate this much longer. And a lot of healthcare professionals, even though I'm in a nursing group for a political figure, you're going to have to deal with this, because this is something that its time has come. And people just have to be out there and keep it up and educate people about it. So this might be a momentum.
I think that's absolutely right. And I would also just say that I think that this is an opportunity to maybe go to some of those fence-sitting members of Congress who weren't willing to sign on before, or who had stayed undecided, and to give them the opportunity to save face and say, it was fine that you weren't supporting it before, but obviously now COVID has changed everything, has changed the facts on the ground. And I think that might be an opportunity to really start to push some of the those who haven't been willing to support it. And I think we should absolutely go after Republicans on it as well and hold them accountable to it.
Yeah, I think Brittany put something in the chat that we need to pay attention to, and that was that the conservative right is always organizing, and they say go big or go home. We need to be doing the same. We cannot rest. We can't take a break on this issue because it's too important. Too many people's lives depend on it. Okay, I want to thank all of our guests tonight for the wonderful job that they did in the presentations that they gave and the information that they provided us. It was absolutely stupendous. So thank you, Melinda. Thank you, Brittany. Thank you, Alex. You did a great job. And thank you to all of the people that were here. And we will we have been recording this, and as soon as it's up on YouTube, we will let you know about that. We have saved the chat, and we will try to condense the comments and things and get those out to you as well. So thank you again, and till the next time.